Over 72 million Americans are covered by Medicaid. Yet some Americans covered by Medicaid don't know that that's their insurance, and that could be impacting the debate over future funding cuts to Medicaid happening in Congress right now. That's according to new reporting that suggests the name of the coverage and the public-private partnership of Medicaid could be partially to blame. For example, some Medicaid programs are named different things. They're not called Medicaid. In Wisconsin, we have BadgerCare. In Oklahoma, Sooner Care. In Washington, Apple Health. And nearly all states now use private insurance companies to run their Medicaid programs like United Health or Blue Cross Blue Shield. So many Medicaid enrollees actually hold an insurance card with paperwork with a commercial insurance company name on it. In fact, 3 in 4 people who have Medicaid are enrolled in a managed care organization and might think they have private insurance and not that public-private partnership. Physicians, public health experts, and advocates worry that the confusion over Medicaid is affecting the public debate over funding cuts. Republicans in Congress are considering proposals to slash hundreds of billions of dollars from Medicaid funding, and the specifics of those cuts are still being discussed. But any reductions to federal Medicaid spending would shift those costs to the states, and that would likely mean cuts to coverage and/or services. And it's harder to advocate if you don't fully understand the benefits and services you have and what's at stake. Dr. Adam Brown, a Washington, D.C.-based emergency physician, said, "We sometimes frame this debate over Medicaid cuts as people will lose their health insurance." And he says that's true, but the constituencies affected are not just the people that have Medicaid. Less funding for Medicaid or an increase in the number of people without insurance would harm people with any kind of insurance. And he says it could lead to longer wait times at hospitals, fewer services offered, and in some cases, hospital closures. And I would add, in some cases, higher costs. You can read more on that reporting. We link to it in the description below.